Well, the problem is diabetes is such a complex disease that it can be silent until the onset of complications. So people have going around their business, but blood sugar is high because they are not feeling pain here and there. They think that they are okay, they are normal, but it's causing quiet damages inside until people present with kidney failure, with strokes, with gangrene, and we have to amputate. There are people that present for the first time with some of those chronic complications, and that goes to emphasize the importance of checking, doing medical checkups. In fact, what the Federal Ministry of Health is advocating is that any opportunity for anybody to get to a hospital for whatever reason, blood sugar should be checked.
Beyond the blood pressure,
of course,
to check
the blood sugar.
Blood sugar. Okay. What about lifestyle factors? We hear a lot that, it's the way you live your life that determines whether you're going to have diabetes or not. Is that a myth or a fact? How much of Nigeria's diabetes burden is really about life factors, and how much of it is other issues? Okay.
Well, there are different types of diabetes, but 95% of the diabetes we are discussing is type 2 diabetes, and that's the one related to lifestyle, to how we live. So it's very important discussing the issue of life factors. And I think what is critical here is for people to know what the risk factors are, what makes them to
So what are
now the first is aging. As we age, there are metabolic changes in our body that will tilt the body naturally towards the disease side of the spectrum of life. And so blood sugar will rise with age. Naturally, blood pressure tends to rise with age. Even the cells tend to misbehave, to go out of order, and the issue of cancers will come. But if we don't want to go that natural way, we need to change behavior at some point. So aging is a risk factor. The next important risk factor is family history. If one parent has diabetes, any of the children of that one parent has a 40% chance of having diabetes. But I'm quick to say, if you have a 40% chance of having a disease, there's a 60% chance in your hand to get the information.
Of not having it.
Live right and not have it. But you need the information to be able to live right. Now, the next risk factor is overweight and obesity. I always say God is a perfect scientist. For every height, there is an ideal weight. When you allow your weight to get beyond what that height is meant to carry, that's the beginning of problem. That's the beginning of, the lifestyle diseases, diabetes, hypertension, and so on. And how does weight come? It's simple economics. When our input is more than our expenditure, there is an imbalance that settles as fat. Okay, so weight on its own can bring diabetes without a family history. Weight on its own can bring hypertension without a family history. Weight can be the reason for some cancers that we experience. Okay, so if and I usually tell people that, we have simple ways of measuring where exactly we are. So I ask people, get your weight in kg, get your height in meters, and divide your weight by the square of your height.
Okay.
Somebody is 60 kg and maybe 1.5. 1.5 times 1.5, divide 60 kg by that, you get your BMI. So if BMI is more than 25, then there is work for that individual to do. Also, very importantly, I tell people to take the telos tape and measure your waist circumference. Okay. Put it around your navel. For males, if it is more than 40 inches, then they have accumulated something here that they need to get rid of.
There's no evidence of good living.
No, it's not. Okay. For females, if it is 35 inches, more than 35 inches, they have accumulated something here that they need to get rid of. It's not evidence of good living. In fact, the most sensitive indication that diabetes is coming, hypertension is coming, is the waist circumference. So, but in our environment, I'm quick to say, we have beliefs and cultures that are counterproductive to what we are discussing.